uh, me lecturing to you,
Okay.
kind of thing. I like that better if that's okay.
Okay.
And then don't mute yourself yet because I just want to make sure you can see what I need you to see.
Of course.
Okay.
Hello. Oh, yes. I can
And
see your
can you
screen.
see my slides?
Yes, sir.
Yes, I can see it.
Okay, cool. All right. Well, thank you again for coming. It's great to meet you both, Tony and Jimmy. And I'm sorry. Yeah. And then Liz might come on later. Okay. Like I
Yep.
said, if you have any questions, don't hesitate, just interrupt. And and as I said before, Arnell and I have known each other for many years now. I'm a big fan, and we were talking the other day, and I know Arnell is a new practice owner, and she was kind of expressing some of the struggles and fears of being a new practice owner. And I was like, yeah, I've been there, done that. And but I'm happy to share, my experiences. And one of the things I love doing is this presentation. I'm the past president of the American Dental Association. And so last year I gave probably 200 or so presentations. Hardly any of them were about the practice of dentistry. Mostly were about philosophy and future of dentistry and wellness and stuff like that. And this kind of incorporates all of it, but from a practicing dentist perspective. I used to be a part-time instructor at the dental school here in Colorado, also at University of Michigan when I was there. And but I'm not, because of my leadership, I didn't have time to do that anymore. But I still give this lecture to the dental students on their final occlusion class. So it's basically, how do I incorporate occlusal concepts into my practice, but it was more about my practice philosophy, not just how do I do equilibrations.
Dr. Kessler, we have somebody in the chat saying, go blue.
All right, go blue.
Hey,
Woo-hoo!
Catrice, we're so glad you're here. So we have Dr. Catrice Austin. She's joining us too. Hey, thanks. Look at y'all.
Hi,
Okay, come
Catrice.
on then.
Awesome. This is great. And so, Catrice, if you have any questions, please don't hesitate. Okay, because I'm just looking at my screen. I don't get to see what's going on. So if you ask questions, I know I'm landing or not landing. Okay, so here we go. Get back in this screen. My practice was called Town Center Dentistry and Orthodontics. It is in Northeast Denver. I opened it up in 2003. It was my seventh or eighth job in my eighth year of practice. We got someone else coming on right now.
Yeah, I
Um,
think that might be Liz. Sorry, I'm not sure. I think
okay,
with the 386 number.
great. Um, and it was, and I give this to, like I said, dental students and young dentists, but also to different study clubs across the country. And so it wasn't my first job by any means. And I always tell the new dentist, your first job won't be your last job, and you're going to learn something in every single experience that you're in. You're going to learn what you like. You're going to learn what you don't like. You're going to learn what you're good at, what you're not good at, and that's what I did. And, through my different job experiences, I kind of distilled out the things that I wanted to do and the way that I wanted to practice, and I felt the only way I could do that was starting it from scratch. And so I did that in a growing area of Denver. Okay. My practice philosophy, it was a relationship-based practice with a comprehensive approach towards optimal dentistry. So I studied with Peter Dawson back in the day, and I went to classes at the Pankey Institute. I set out to be the best dentist I can possibly be, and so I wanted to be training where they were training, and I met these amazing dentists who were doing the kind of dentistry I wanted to do, and they were successful at it, and they shared with me how they did it, and just like I took from them things that I thought can work in my practice future, I would ask you to do the same thing. This may not be for you, but there will be parts of it that you can use tomorrow. And take what you like, leave what you don't. It's cafeteria style. Okay, this is how. And I'm going to back up. I titled this a comprehensive approach to dentistry. It is not the comprehensive approach to dentistry. This is my version of it. And so relationship based versus commodity based. Through my last couple of years, through my travels across the country as president of the ADA, I spoke a lot about wellness, and I see there's a huge wellness problem in our profession. Burnout is way high. I think 82% of our colleagues are experiencing some kind of burnout. Mental illness is way up, substance abuse is way up, suicide is way up. And in my history, I'm a recovering alcoholic and drug addict. And so my serenity is the most important thing in my life. And that's part of why I developed this practice philosophy, because I thought it would bring me the greatest satisfaction to practice this way with the impact that I can make for my patients. And so, we look at relationship based versus commodity based. And I think big part of the burnout, especially in the younger dentists, demographics, is that a lot of them are in very high volume practices, and they're treating teeth and they're not treating people. And I think they miss out on some of the things that I really cherished from my practice. And so, I just wanted to just describe that. And so the difference between the commodity base and relationship base is it has to be a perception of value. If I, view dentistry as a commodity, okay, a filling is a filling is a filling is a filling. The insurance industry views us as the work we do as commodities, and that's not fair. There's different levels of complexity, both on the easier side and the harder side. And I was a 100% fee for service practice, but I was able to adjust my fees according to the level of difficulty that I was expecting to encounter with the patients and things like that. So if you look at, we're looking at value, we got to look at sales. And I don't want this to sound like this is a sales pitch for anything. But from sales people learned how to read the psyche of their customers. And we as dentists, if we're going to be most effective with our mission to provide the finest care to our patients, we have to understand where they're at, because just because we tell them doesn't mean they're going to say yes. And so, people will purchase a product or service so they value that product or service. Flat screen TVs in 2024, $227 billion was spent on flat screen TVs back then. Okay. And there's no flat screen TV insurance that helps them purchase that. They bought it because they wanted it. Okay.
I'm laughing at the bottled water.
Yeah. $50 billion in 2024. And it's just, if you look at Evian, I think I've got a picture of it. What does Evian spell backwards? Naive. Okay. Some French guy is like, oh, let's put water from my hose in my backyard into a bottle and we'll sell it to these naive Americans and we'll call it Evian, and they'll pay for it. It's just water. It's but people buy it because they want it, for whatever reason. The fluoride in the water, there's no fluoride in the water, whatever. They buy it, it's convenient. But there's a difference in sales between people who want something and people who need something, especially around healthcare. If there's a healthcare need, we have a culture that says if it's necessary, then someone else should pay for it. I cannot access it if I don't have insurance, if I don't have benefits. And we all know that's wrong, but we've got to get over that and help our patients get over that too. I remember I was at a Denver Nuggets game. I was sitting courtside. My oral surgeon gave me courtside tickets. And back then, Delta Dental was one of the big sponsors of the Pepsi Center, and all the lights went off for the introductions, except for the Delta Dental was, their sign was everywhere. And I tapped the guy next to me. I don't know him. He didn't know me, but I just played dumb. I'm like, hey, what's that Delta Dental thing? He's like, oh my God, it's the greatest thing ever. I didn't go to the dentist for like 5 years. And then now that I've got dental benefits through Delta, they're awesome. I get to go. And he spent probably $1,500 per seat courtside, but he was unwilling to spend $100 on a cleaning because he didn't think that was possible because he didn't have benefits. Sorry, do you have a question, Jimmy? No?
Nah, just that it was $1,500 seats versus $100 cleaner.
Right. Yeah. So, but there's this perception that we need to have someone pay for it if it's a need, right? So when cost comparison is the only variable, people will always choose the cheapest. So if I want to buy a box of Cheez-Its and I go to my local grocery store and I know it's $1.99 here, but I know if I'm going to Walmart later and it's on sale for $1.50, I'll wait and go buy that same box of Cheez-Its at Walmart later because it's the same, it's a commodity, it's the same product, and I'll try and get it cheaper. But if other information is entered into the equation, cost becomes secondary. So let's look at blue jeans. I could buy blue jeans from Costco under the Kirkland name, and those blue jeans will cover my behind. They'll have pockets for my keys, my wallet, and my phone. They'll protect me from the elements, and I'll look fairly okay with it. Okay. And it'll cost me $35. I can also go to Nordstrom's and buy a pair of jeans from Nordstrom's, but I'll have a salesperson there giving me in different styles of jeans, telling me my behind looks good. My behind will be covered. I'll have pockets for my keys, my wallet, my phone. I'll be protected by the elements. And that experience will be much different as the salesperson's giving me different options or giving me clothes to match and, you know, styles and things like that. And the cost for those jeans are $300 and some dollars. Same function, covering my behind, pockets for my phone, keys, and wallet, and cover and protect me from the elements. But there's a different sales experience that that is attractive to me, that I would want to buy it from Nordstrom's and not from Costco. So it's they invest in the experience. Back when I was growing up, so I'm 57, so this is in the 70s. There was always a commercial that came on for Folgers coffee. This is before Starbucks even existed. And Folgers, the tagline is, "The best part of waking up is Folgers in my cup." And the commercial would start with the sun would be coming up over the trees. There'd be someone sleeping. They'd and then they'd move over to the coffee maker that's on automatic set, and that was a new thing back then. And the coffee would start to brew, and you can almost smell it through the television. And the person, it'd go back to the person sleeping, and they'd open up their eyes and they'd smile and take a big deep breath in through their nose, whiffing the Folgers and getting that experience of coffee. So Folgers today is $12 a can, and you get 100 cups per can. That equates to about 12 cents per cup. Okay. And it's coffee. Starbucks, $4.50 a cup, $5 a cup, $8 a cup on a regular basis. And there is a line out the door every morning at Starbucks. And there's a line of cars around the corner of the parking lot waiting to go drive through to get Starbucks, because they invested in the experience. When I buy something, the decision to purchase something is usually based on logic or emotion. And I would say when I purchase something, it's based on emotion, and then it's justified by logic. So I had a patient who was a car salesman, and I told her I was looking at a new car. We just had our third kid. And so she's like, "Oh, I'll bring a car over to your office. What time do you take lunch?" And so I told her noon. She's like, "Okay, on Tuesday at noon, I'm coming over." And I wasn't ready to buy a car, but she came over at lunch, and it was a Volvo dealership, and she was the salesperson, and it was an SUV, and I got behind the car. At lunch we went for a drive. I took it for a test drive, and I fell in love with the car. I just felt right inside it. I'm like, man, this feels good. It's black. It's got tan interior. It's got a great stereo. It feels good, and I'm driving it around, and I knew right then and there that I was going to buy that car. I came back from lunch. I practiced with my wife. She's an orthodontist. And I told her, I think I'm going to buy this car. And I started rattling off, it's got a great engine in it to get us up the mountains. So when we go skiing, it's big enough for all three kids in their car seats and our ski gear. If I put a box on top, it gets great gas mileage. And Gina, it is the safest car in production right now, and we need safety for our kids. So I felt like I wanted to buy it, but I justified it with logic, and that's how people purchase things. Okay, and in 1 hour I spent $45,000, and I had no expectation to do that when I went into that lunch break. Okay, but so and so now how do I create that in dentistry? How do I apply that so patients would provide, or I'd be able to provide care for my patients, they would choose my finest care. And so even if they want it, I have to shift it from need it to want it, and use both into the equation. So we have to invest in the experience. Starbucks spends more money on employee benefits than they do on coffee beans. They're a coffee shop. Coffee should be the thing they charge most on. No, but they invested in the experience so much that people will pay 5,400 times more for a cup of coffee than Folgers that they would make at home, because of the experience. I know Starbucks has really changed over the last couple of years, especially since they went public. But back in the day, Starbucks was it, and it created coffee lovers all across the country, and it was a thing to do. So, and I talk again. This was the final occlusion lecture in the occlusion courses that I taught at University of Colorado. How do we provide a solution to a problem that most of our patients never have? And we talk about occlusion the whole year. I remember when I was in dental school, I actually failed morphology and occlusion when I was in school. But I never bought into it until I was a dentist. And I didn't buy into it because as a dental patient, which I was, I never had anyone take records on me. I never had anyone do a face bow and mount my records on an articulator in centric relation and evaluate my bite. Okay. And then I'd get out of occlusion, and some of the clinical instructors were like, yeah, occlusion's bullshit. You don't need that. Just make sure everything fits and it's okay. And all right. But I went into practice, and I'm like, I'm never doing this shit again. I sold my articulators, and I started doing dentistry fast because I needed to get paid. And then some things started to fail, and I had to really look at the care I was providing. Am I providing the best that I could? And I was an engineer before I was a dentist, so forces and vectors and material choices and the engineering, putting a design project together was kind of what I really loved doing. And so I decided to step back and figure out how to be the best dentist I can possibly be. And that led me to Dawson, Pankey, Spear, Coyce, those kind of things. Okay. So I didn't really as a dental student, I didn't really buy into the occlusion thing, but I came back full circle. But now I'm trying to sell it to my patients, and they don't think they have a bite problem. They don't think it's important because they've been going to the dentist their whole life and they've never had any issues on it. But I had to invest in the experience and change the experience of what's possible at a dental office. And so I got this from the Pankey Institute, and I'm wondering if any of you had been to Pankey. Okay, I could just see.
I haven't.
No.
I've not been to Pankey, but I've been to Spear campus, and I've done a few. I've only done mainly Spear things. I've wanted to go to Pankey because they're right here in Florida.
Right.
And same thing with Dawson. They bring Dawson to our FDC every year, but I just hadn't made the effort to do it.
Okay.
Same thing with Coyce. Yeah.
So all of them trained at Pankey and Dawson. They all did. And that's why, they were instructors there when I was going through the courses. But one of the things that Pankey talked about was the discovery process. And, it really, creates an experience that's way different than any other experience. So I'm going to kind of delve into my practice philosophy and how this can, how everything that I had envisioned for the practice, this fits perfectly. And so in the discovery process, and they teach you this in Pankey, it's a process designed for both the doctor and the patient to discover the condition of their oral health. The patient chooses what fits for them. Quality is the constant, time may be the variable. And so this is in my office. In the middle of the office, there's a consultation room. So it's my wife in the white jacket talking to a patient in the consultation room. And that's what we would, where we would do this before we go into the clinic to do this discovery process. And so the goal of it was to build trust. Patients will only do work with us if they trust us. And so how do you build trust with them? And this process really helps you connect with that patient. Remember, my philosophy was a relationship-based practice, not a commodity-based practice. Dr. LD Pankey talked about, yeah.
I'm sorry, can I jump in and ask a
Yeah,
question at this
please.
point?
Yeah. Uh-huh.
So I have a very small practice and
Uh-huh.
I do not, I've always wanted a consultation room to give that sense of, privacy and discussion. But how do you foster that in like at the beginning stages where I
Uh-huh.
am and it's small, it's literally tiny.
Yeah. So you do it chair side.
Okay.
You do it chair
Jimmy,
side. And
Jimmy, go
and
ahead. I
Oh
thought
no, I was just trying to think myself. I was thinking about how I can do that for myself. I'm thinking maybe I can just convert my office to something that's actually presentable for them to do it.
mm-hmm,
So for me to use that room
mm-hmm,
as that private.
yeah.
mm-hmm.
And again, as I go through this, you'll see if it's possible where you're at, but I promise
Mm-hmm.
you it is. I've
Okay.
seen it. I've done it in different practice modalities. But as I was going through my different office jobs that I was in, I was able to do this chair side. But when I envisioned and put together my business plan for my practice I was starting, it was built into the system. It was built into the design of the practice, so I could do this system in the best possible way. So Panky talked about.
Hey, real quick.
Sure, Jimmy.
I want to jump in and let the
Yep.
people know because a lot of times other people have better questions.
Yep.
He said it's cool for y'all to just jump in and ask a question anytime. He
Yeah.
rather it be a conversation versus just a presentation.
Yep. Thank you. Thank you. And so Panky had this saying. He's like, I never had a tooth walk into my office. It was always attached to somebody. Get to know that somebody, and you may get to treat their oral condition. Don't ever treat somebody you don't know. And I took that to heart. This discovery process will allow the patient to help discover their own issues and decide how they want to move forward. And also, we collect data. So in the process, we go through. I introduce myself. I'm Brett Kessler. Most of my patients would be referred from another patient. Okay. But early on when I started from scratch. I had no patients. So I did a lot of marketing. And so I tried to, connect with the patient in some certain way. I'm sure you guys do that when you meet a patient for the first time. After the small talk, I would go into the philosophy of my practice. And my philosophy was based on a comprehensive approach, based, on the foundation of health, then function, and then aesthetics. And with this process, and I will send you a copy of the questionnaire that I used, so you can use the questions or not use the questions or modify the questions to what fits your approach to how you want to do it. But everything was started with the health, started with the function, then on the function, and then went to the aesthetics. So when a patient would come into the practice, if I think about it, so I was a fee for service practice starting from scratch. I was on one insurance plan, but it didn't account for much. Most of the patients that came in paid cash. And I was the first dentist to open up in this neighborhood. My colleagues told me I was absolutely crazy to open up in this neighborhood. It's a shitty neighborhood. There's a lot of crime. But I researched the vision of this new neighborhood that they're building, and I really bought into the vision. I thought we can be successful. And I visited other, you know, projects across the country where they were building new neighborhoods like this, planned neighborhoods. And I actually went to different dentists in those neighborhoods to see how it would work. And I thought it was going to be wildly successful. So I built this practice. But, my patients over time would be referred to me by another patient. And they would, the patient would tell their friend about this great experience and the work they did. And so the first thing the referral would do is go up on my website and look and check me out. And so the website had to be consistent with the story that their friend just told them to refer them. And if then they are, compelled enough to call, they would call the office for the first time. And that first phone call had to be consistent with the referral discussion with the website and then be able to answer this person's questions. And if we got to the point where they would actually come in, this was a picture of my waiting room when we first opened. And my receptionist, my office manager would step around the desk, introduce herself to the patient, get to know them a little bit, give them a tour of the office, and then seat them in this waiting area and give them some forms to fill out. And so the forms, if you can see, the chairs are about the same level as the desk of the office. And when they're finished with the forms, later on, I put my mission statement up right here, eye level. And if you think about it, I don't know, many people do not have a vision statement or mission statement or core values up on their in their business. And I was very clear. I wanted this to be different. So we had a very amazing design, and we had an amazing experience as they come in, and then we're going to have them fill out some forms, and then they see this mission statement. As you can see over the mission statement, that's me and my team. My wife is right to my left over here in the top middle. And so I'll read you the mission statement. Our dentistry is an artistic blend of beauty and function built upon the foundation of optimal health. So again, we're talking about function, aesthetics, and health. Okay. Through our commitment to putting people first, we develop a mutual respect between our patients and our dental team in a comfortable atmosphere of trust and integrity. I'm going to share these slides with you so you can, dig into this if you want to. Okay. So in this first paragraph, we're telling this patient that healthcare, they're going to have a very different healthcare experience with us because we're partnering with our patients, mutual respect, atmosphere of trust and integrity. This is what we are trying, people first. This isn't healthcare. We partner with our patients to identify their goals and create strategies to support their wants and needs. That's the discovery process. We believe that through personal discovery, education, ideal dentistry, and maintenance, we create dentistry that can potentially last a lifetime. And I really believe that even to this day. We value the relationships we have with our patients and within our team. We look forward to seeing our patients and helping maintain their smiles throughout the years. So now we're telling them that we're not only going to take care of them, but we want to have relationships with them, and we want to help them maintain their oral health over their lifetime. And I can tell you on the referral, just an aside, right before this call, before this presentation started, I got a message from an old patient of mine. I'm just going to read this to you. Hi, Dr. Kessler. It's been a while. I know you're not practicing right now. Do you know of anyone in town that does super good work? And wait, no. Are you practicing? If someone wanted a referral on who did my teeth, and I said, I'm not practicing anymore. She's like, oh, it's too bad. Do you know anyone in town that does good work? So that's 10 years later after I did her work. It really worked for us. So we're maintaining it over the years. We're committed to self-improvement, both personally and professionally. Consistent growth allows us to maximize our contribution to ourselves and our families and our patients and to the community at large. So here we're telling everyone that we want to be integrated, not only with you, but we're trying to grow to be the best we can be, so we can be on top of the latest advances in dentistry, so we can provide them for you. We want to contribute to you. We want to contribute to our families. We want to contribute to the community. So very different experience. So now they would, my office manager would escort the person into the consultation room, and then I would enter there. Okay. And so I have these lists of questions, and the questions are designed to help the patients think about the three aspects of focus for my approach. And again, I use health, function, aesthetics. If I get those three things right, patients will be happy, and it's very predictable and it's long lasting. Okay. So that's the first thing, will be the questionnaire. And in this process, I want to determine their initial short-term goals and their long-term goals, and we'll have some question and answer. I hope that I can establish a relationship. This is an opportunity to build a relationship and accelerate the trust factor. Okay. I want to share my practice philosophy. I want to hear their chief concern. So I'll send you these slides so you can have a copy of this, and I'll actually send the document of the discovery questions if you want. And so I'll do some small talk with the patient to find out how they found us, where they live, what do we have in common, that kind of thing. And then I'll get into, if it's okay, I'd like to tell you a little bit about me and my practice and what we're all about. And then I've got some questions for you. And so, we started the practice in 2003, and I'm hoping to, look at all aspects of your oral health and how it relates to your overall health. And, going through the health, I go through function, I go through aesthetics, and I kind of give a little synopsis of my mission statement. Like, if we get this all right, we can have dentistry that's predictable and lasts a long time, and it's beautiful. Are you okay with that? Oh yeah, it's great. So then I say, well, what brings you in today? And they would give me a story. Sometimes it's just, oh, I'm here for cleaning and a checkup. Sometimes they go into a diatribe of, their last dentist or why they're not happy. Again, there's about 1,500 dentists in Denver. They can choose to go to any. Many of them, 95% of them, take insurance. And but yet they're coming to me, and I have to provide an experience and sufficient enough where they will take money out of their pocket and hand it to me for my services. Okay. And so they will tell me stories about, bad dentistry or bad childhood dentistry experiences, or they've got a tooth that's hurting or a tooth that's broken or their jaw's hurting, things like that. And so and as they start on this story, I interrupt them like, hey, can I interrupt you for a second? Yeah, but they're getting into this room. Is it okay if I take notes on what you tell me? And, I make sure I interrupt them and let them know I'm going to take notes on what they're telling me. And I did it on pen and paper. I did not do it by computer. I wanted to make sure I'm in front of the patient, writing things down as they say to me. And now you could do it on a digital notepad, things like that. But I would write these notes and I'd scan it and put it in their chart. This was early 2000s. Okay. And so then I let them continue on with their chief concern. And then I'll stop them and thank them. And I'll say, I've got some questions for you, if that's okay. Do you mind if I take some notes? And I start out with the health. And my first question to them was, well, tell me about your health. They'll dive into their illness history, and I'll stop them. I'll say, no, not what's wrong with you and diseases you have, but tell me how you feel about your health on a scale of 1 to 10. How healthy are you? I live in Colorado, and we're the healthiest state in the country. And so we're very health focused. And so I'm already changing the paradigm that we are health focused, not a disease focused healthcare provider. Okay. And so they'll say 8 out of 10. What would it take for you to get to 10 out of 10? Well, I need more sleep, or I need to lose a couple pounds, or I need to eat better, or I need to stop drinking, or, things like that. Just want to know. Then I'll ask them, how does your oral health play a part in your overall health? I want them thinking about how does their connection of their teeth and gums to their overall health, how will that play a part in it? And that makes them think for a little bit. Well, I need it for chewing, or I need it to smile so I feel good about myself, or whatnot, or I'm in a lot of pain and chronic headaches or neck problems and things that I treat. And I want them to start thinking about that. Then I'll ask them about their history and the thing that they filled out with the forms of any diseases they have and medications they're on. So already different experience. I am focused. Everything is focused on getting them healthy, getting them to function, and getting them to be proud of their smile. Okay. Next question I ask on the health section is, do you feel you've had a lot of dentistry in your mouth? How do you feel it's holding up? When was the last time you were at the dentist? What was done at that appointment? And I just let them talk, and I'll ask more questions or glance over questions if I don't feel it's appropriate in this situation. A piano has 88 keys. You don't play all 88 keys to make music. This is 88 questions. I don't know how many questions, but you don't need to ask all those questions if it's not, relevant to the situation. But I want to know when they were there last and what was done. And I'll ask them for, how was the experience, blah, blah, blah. Do you feel like every time you go to the dentist, you have to have something done? And, oh yeah, I hate that. It's every time I go, something's broken. It's like, I can never stay ahead of it. I got real soft teeth. And I would say things like, well, would it be important to you if we can get you stable so that doesn't have to happen in the future? She's like, I don't think that's possible. I didn't know that was possible, because they've got a history of and a story going on in their head. Then I'll ask them, what do you do on a daily basis to take care of your teeth? And the first thing they'll say is, well, I don't floss. No one ever flosses. It's very rare that you get someone that flosses. And I never judge. And they'll say, well, I brush them twice a day, blah, blah, blah. I'm like, okay, do you use a regular toothbrush or an electric toothbrush? Just by asking that, they start to question, is one better than the other? We're already health focused. How can I be healthier? And so I'll ask them, and then I'll ask them, do you change the heads if you've got an electric toothbrush, do you change the heads every 3 months? Do you get a new toothbrush? No, I just get it when I go to the dentist. I'm like, okay. Okay. And do you use any mouthwashes? And they'll say, yeah, I use it. And I'm like, what kind? And they'll say Listerine. I'm like, why do you use Listerine? Oh, I like the way it tastes. I'm like, great. Listerine is great for your gums, and it helps make your gums healthier. People will say Act, and I'll say, why do you use Act? Well, my dentist thought I should because I get a lot of fillings or I get a lot of cavities. People say Scope, it does nothing for you, and I'll let them know that it's just there to freshen your breath. But I want to know why if they first of all asking if they use any mouthwash. Again, they start thinking maybe I should because it could be better, it could make me healthier, and then choosing what kind. And I'll tell them, based on what I see, I may recommend a certain kind of mouthwash so we can idealize your health. And they'd be, are you okay with that? Oh yeah, absolutely. I keep asking them permission to present to them. Then I'll ask her, any teeth bothering you currently? What's wrong? Sensitivity, that kind of thing. Then I'll shift from health to function. So the next section is, have you ever had any pain in your jaws, your face, or your facial muscles? And when I'm doing that, I put my hands on my face and I get my temporalis and I get my masseters covered because I want them to know this is what I'm looking for. And then I'll ask them, did you notice if your jaw ever makes any noises when you open or close? And I'll go like that, and I'll put my hands on my jaw. Does it make any clicking sounds or popping sounds? Has it ever gotten stuck open or stuck shut? And I treated a lot of people with oral facial pain, so stuck was a thing for my patient demographic. But a lot of them are like, what, you could get stuck? I'm like, yeah, it does get stuck if there's jaw problems. And, I'm going to be looking at it to make sure it never gets stuck with you, those kind of things. So I would add that into the value of the service that I'm giving right there. Do you notice if you grind or clench your teeth? Well, my dentist told me I did when I was younger. My spouse tells me I do, but I don't think I do, blah, blah, blah. They always get kind of defensive about clenching and grinding. I think it's kind of funny. And I don't know about you, but I can diagnose someone who clenches and grinds across the table, across the room, just by their anterior wear. I can tell, and how big their masseters are. I'm always judging faces. And so I know if they are or they're not, whether they know or not. The goal of this is to see what they know about their health, not what I know about their health, to find out what they know, because we're trying to engage them into the process and discover their problems. Can you eat all the foods that you want? And that opens up all sorts of conversation opportunities. They can't open wide, they can't eat, sandwiches, or they're missing teeth, so they can't chew their food enough, or their jaw hurts, so they can't eat anything really chewy. So those kind of things are really important to know. Do you avoid any foods? Yeah, I can't eat anything that's cold because my teeth are just so sensitive. And then I ask, are you missing any teeth? Has that affected your ability to chew? Is that a problem for you? Do you sleep well at night? Do you wake up a lot? Do you snore? Has anyone ever told you that you snore? Are you always tired? And they're like, why are you asking this? And I say, well, there's a lot of things in airway that affects how you function. And I always go like this when I say function, just mimicking that clenching. Because in my philosophy, health and function, if we can manage the bacteria and the inflammation in the mouth, and we can manage the forces in the mouth, our dentistry becomes very predictable. And so I want to be able to identify that and help the patient identify that too. Then lastly, we go into questions about the aesthetics of the smile. Are you happy about your smile? Happy with your smile? They'll always say, I wish it was whiter. I don't care how white they are. They'll always say they wish it was whiter. And then I'll ask specifically, is there anything that you would change if you could? And I'd give them a mirror and I'd put it right in front of their face. And they'll tell me certain things, or they'll say, no, I like it. I'm very happy with it. Great. And I put the mirror away. And then the key question, and this is, I don't care what practice modality you're in or what philosophy is, that this is the keyest question that you can ever ask your patients. What are your goals for your teeth? And shut up. Don't say a word. Let the patient think about it and let them come up with something. And then they'll say, well, is that a short-term goal? Is that, how important is that to you? Or is it something long-term? Okay. And, and just let them articulate it and then write it down. Then I'll ask them, is there anything else that we didn't talk about that we should have, that'll help complete the picture that we need to talk about? And a lot of times I'll go into, because by now we've built a level of trust, and they'll tell me about, unfortunate experiences they may have had in their past. Okay. But the key is you can't lead with that. You have to build the trust. Okay. I'm going to stop for a second and take a drink. Does anyone have any questions or comments? And I just want to see if this is landing.
Nah, it's all good stuff.
It's good. Yeah. I was going to say, I see
Awesome.
some stuff in the chat while you're taking a drink. Dr. Catrice says she always asks the patient's goals. I have
Beautiful.
not gotten in the habit of that. So this is good for me. Same with asking, there was something else about the core values. Oh, asking about their foods. I usually only ask that when I'm consulting like denture patients, but I've never even thought about it to ask patients just that are there for regular care. So it's good.
Yeah. And this is where you can implement this tomorrow.
Yeah.
Every hygiene check. Okay. You've
Yeah.
probably been seeing patients. I don't know, you haven't owned your practice that long, but some of you
No.
have owned it longer. You've seen them through your hygiene cycles. And, a lot of times we'll walk in because we're busy doing our restorative stuff. And hygiene's always, in my mind, was always an afterthought. And it was a pain in the ass. I'd have to leave, lose my momentum and go. But I would always sit the patient up if I hadn't met him before. And I would, ask them, I know we've been seeing you for X amount of time, but I never really asked you what your goals are for your teeth. And I want to make sure that I'm providing everything I can to help you with your dental goals, but I don't know what they are. And so then they'll start talking about things, or they'll say, no, I just here for my cleaning, make sure everything's good. Okay, great. But a lot of times it'll open up opportunities that for them to say stuff that they never said before. And it may not happen the first time, but the second time you ask them at their next 6-month cleaning or 3-month cleaning, they may bring up something because now it's planted a seed. And because it's going to throw off your schedule, and your hygienist is going to be pissed, and your dental assistant is going to be pissed, and the patient that you're supposed to be treating in your restorative side is going to be pissed because you're making them wait. You can just say, hey, Miss Jones, okay, this is all good stuff. And I don't have, I've got another patient waiting for me right now, but I really want to explore more about your goals. Can we schedule a time later this week for maybe a half an hour where I can dedicate it to this conversation and no charge? I just want to know. And that will, again, bring value and make it a very special moment for the patient that, hey, this doc really cares. And they will come back with things, and you'll have the time dedicated, and then you take your notes. Okay. And then you can use that later. Okay. So this is this, so that you can do tomorrow in your hygiene chair. Okay. So, health questions, function questions, aesthetic questions. Discover their short-term goals and their long-term goals, anything else to complete the procedure. So this is all in their very first appointment with me. They don't see the hygienist first. They don't get probings. Okay. I was not a cleaning office, let's say. Okay. That was not my primary driver. I had a small practice of about 750 patients. We have about 4 million people in Denver. I only wanted to see 750 of them. And I didn't want to be the dentist to everybody. I wanted to focus on these things. And I wanted to focus on patients who valued their health, valued their overall health, and were willing to pay for it. And so that's why I created these systems to attract that. Okay. And so this is before we even go into the clinical side. This is all just me and the patient talking. And sometimes I would schedule an hour and a half for the comprehensive exam. Sometimes we never got into the clinical part of the day. Okay. Because to me, it was much more important to build the trust with the patients than to collect data. And it paid off in spades, not only financially, but I was able to really connect with my patients on a deep level and do dentistry that I thought was really exciting on my terms. Okay. So if we get to the point where, and sometimes we decided it wasn't a good fit in this discovery. And I'll tell you, I never got burned on the case I didn't do. And so
That's good.
I dismiss some people here and say, I don't think my best talents can meet up with your lowest expectations. My best dentistry can't meet up to what you're doing. I'm saying, I don't think I'm the right dentist for you, but let me give you to someone who I think is. So if they're very hooked on their insurance, so I really want one of my insurance covers. I'm like, I'm not that office, but I can, help you find a dentist that takes your insurance, and they can treat you if that's what you want. But you're always welcome back here, and I'm happy to help. But this is what we do here. Okay. And so sometimes it was I'd rather, meet you for coffee and get to know you there than provide you care that I can't, that it won't be satisfactory to you. So questions.
Dr. Kessler, how do you get your team to buy into this? For one, and then two, when you are like newer, like some of us here that are, I think we're focused on our debts too. So it's like, how
Mhm.
do you afford to spend this much time? I think I know the answer is like you can't afford not to, but I would love for you to, zoom in on that for us if you can.
Great. A very, very good question. And it's real. I hear you. It's real. When I started this, I took out about, I don't know, $800,000 loan to build the practice. I had one employee to start and no patients. The day I opened up the practice, I unlocked the door and I popped my head out the door, and I looked to the left, looked to the right. I'm like, I freaking hope someone comes here today to see me. And hopefully the marketing picks up and, starts bringing people. There's definitely risk there. And I supplemented my income in the meantime, working at other practices to, while I built this. And then, and as I built this, I took the chance finally to hire a hygienist so I can be more productive in the restorative side. Um, so I had to find ways to supplement that. The team that I created around me, going back to my mission statement, I'm just going to reverse here. When we were slow, which was a lot early on, I did team building exercises, exploring how can we take the philosophy and put it into action. What can we do to provide actionable, valuable actions that will, create the kind of dentistry that we want to do? So I attracted people that were totally bought into this practice modality. Okay. And it was nothing special. I said, I want to be able to get to know my patients. I want to be able to provide the finest care for my patients. But I need the right people around me to be extensions of my philosophy. How do you make them extensions of your philosophy? You have these discussions with them, and we would schedule it once or twice a week, especially early on when we were slow. And we created this mission statement together. I knew what I wanted in it, but the girls that worked for me, I'm sorry, I shouldn't say that. The lovely team that I created, you can see their picture behind there, that they helped create the pros here. And so they were bought in, and many of them worked with me most of my career. And so just like your patients will, your pay any business you do business with, them because there's a value that business has that matches your personal values. Okay. So I love working. I'm a skier, so I'll buy Patagonia ski equipment. First of all, it's high quality equipment, but I love what they do for the environment. And so I'll purchase Patagonia over, Arc'teryx or something like that. So it's like, so you will have values. If you're living your values, people know it, and people will be attracted to it because they value the same things. And so that's how patients will choose you. That's how your staff will choose you. We're in a time right now where workforce shortages are really hurting the profession. But the ones that aren't hurting are the ones that are very clear on their values, because they're attracting people who want the similar values and similar work environments. And when we're doing this work, so I can make $30,000, $40,000 in a day on one or two patients. Okay. Imagine doing that in a 10-chair office. How much work is involved to produce that much dentistry in 10 dental chairs? Okay. So no one likes working that hard. No dental assistants like it. I don't, and my front office would have to confirm everybody. The dental assistants have to turn over the office, the operatories, the hygienists are scraping and doing their stuff. So it's like, I'm working harder or am I working smarter? And so people buy into that, but there is risk. And early on, it was scary, absolutely. But at the end of year one, I think we produced $675,000 from scratch. Okay, and very little marketing, and and big risk, no patients, starting at zero. Okay, all because of this process. I was very clear what I wanted to do, but I was several jobs into what I wanted, and I was very clear on what I wanted and who I attracted. And so not everybody was the right patient, and I saw everybody at first, and I made a ton of mistakes, but I had to pay the bills. So, okay. Any other questions with that? Did that help or no? Okay.
Big time. Yes. Jimmy
Okay.
came off mute. Go ahead, Jimmy.
Oh, no, 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 I'm good. It was good.
Okay. Cool. So my comprehensive exam, I started out my dental assistant. I'd bring them then from the consultation room to the clinical area. I'd introduce them, hand them off to my dental assistant who would be waiting and ready. And they would take study models. They would take necessary radiographs. I don't care if they brought their own. I wanted my own too. And I would have them take digital photographs with an SLR type camera. Then we'd come in and I do the comprehensive exam exactly like I did in dental school, like I was taught in dental school. I found early on my clinical exam was just looking for cavities and getting out of there as quickly as possible. Okay, but this way I really dug in and I, spoke over my patient so my patient would hear it, and I would and make sure that it was in terms that they understood. Okay, so I start with an extra oral exam. So I would palpate their jaw, and I would note, yeah, there's a click on the right side when they open. The jaw pops when they maximally open. There's noise in their jaw when they open and close. There's crepitus. They have a full range of motion, or their motion is limited, or it only opens and it moves to the right when they open. Things like that. So the patient's like, "What? What's going on?" And I give them a mirror. Here, look. When you open, your jaw swings this way. Did you know that? Helping them discover is what I'm trying to do here. Then I'll take their jaw and manipulate it into centric relation. Okay, I'm a nerd like that, and I really believe in it. And so I would do how easy can we manipulate them, and then I would see what their initial point of contact was. Was there a slide? And if there was, what's the direction and the magnitude? Then I would load their jaw joints. So I'd put them in the CR manipulation position and I'd push on their jaw to see if there's any pain in there. Again, I had a very large amount of patients who saw me with head and neck facial pain issues and things. So that was pretty big. And, loading the joints is an indication of damage in the joints. And it was very informative to me. I would palpate all of their muscles, and their jaw muscles. This one's, doing okay. Does this bother you? Oh yeah, it's a little tight. Do you ever get headaches up in here? Oh yeah, all the time. I would just ask them questions about it and we note it. I do my oral cancer exam as I'm, palpating the sternocleidomastoids, looking for lymph nodes. I'm asking them to use any tobacco or marijuana products, any illicit drugs, those kind of things. Just asking them as matter of fact as possible. I come from Colorado. We were the first state in the country to legalize marijuana. So you would be surprised who said yes at the time. But I just matter of fact and accepting them for who they are and what their habits were. Then I'd move inside the mouth and I do a typical operative exam and chart all the restorations. Are there any, leakages or breakages of those restorations, any cavities, any teeth fractured? And I note that, this tooth number 14, upper left molar, this tooth has a big crack in it right through the middle of the tooth. Does this tooth bug you at all? Well, yeah, it is a little sensitive up there sometimes, and they're like, crack, what's cracked? It's broken. And they'll start asking questions during the process. I know I'm got them engaged when they're asking questions. questions. Okay, and then I'll follow up and I'll finish it up with the occlusal exam. Note any wear on their teeth, any abfractions, what's their occlusion type, is there any fremitus, initial point of contact, any interferences, what is their grinding pattern? And as I'm doing this, I'm asking them to move their jaw around, slide them back and forth, front and back, and especially in a wear case when there's anterior wear, I'll make them move forward so their edges touch and their lower edges meet their upper edges. And I get a mirror and I'll show them. I go, look how your teeth fit together. It's just so perfectly like that. Do you notice yourself grinding like this? No, I never grind. I'm like, well, it's so interesting because they fit together perfectly like that. I bet you do and you don't know it. Just getting them interested in that. Okay. We'll do my regular perio exam, 6-point probing, any recession, any attachment, any mobilities, what are the furcation status in the molars. Okay. And then I'll finish up the oral cancer exam. Then I'll do an intraoral camera tour of the mouth where I'll take close-up pictures of certain teeth to highlight. And I'll go back and take pictures of cracked teeth. And I'll note, yeah, we want to make sure that crack, I can show you that crack. They're looking at it, I'm moving, they're moving with me. And I'm like, okay, let me get it. And then we can look at it together. But I had the monitor right over them so they can see everything that I'm doing. Okay. And then I would go through it with them. Okay. Then that would end the exam, and I would talk to them and say, and if they had a short-term problem, a chief complaint, something that was hurting, something broken, I'll say, yeah, we need to get that tooth fixed ASAP. It's going to need a crown. Let's get you scheduled tomorrow for it, or later today, or whatever. When can we get in to match it? And we'll get that. But then all these other things, I'll say, there's a lot going on in there, and I just took a whole bunch of data of what's going on in your mouth. And I would like to, if it's okay, I'd like to sit down and kind of just think about everything and put it together in a place where I can talk about teeth that I'm concerned about, that have high risk of having problems, and, you told me your goals are, that you want to keep your teeth for your life. And so I'm just going to put something together and bring you back, and we could talk about that another time or a week later. Is that okay? Oh yeah. Okay. Cause I've already given them a much more thorough exam than they've ever had. And so they'd be interested to see what I found and what I have to present. Okay. I'll tell them that I'll assure them that there's predictable solutions to everything. I'm so glad you came in. I'm so glad we got to look at you at this level, and I've got some great ideas for you so you can have peace of mind with your mouth. Okay. But then I'll send them home with some homework. And so I'll ask them I know you don't floss, but when I showed you, when I was doing my gum exam, I know you got some infection in your mouth, and we're going to have to deal with that. But the best way to deal with that for you is to start flossing. So let's try flossing for 2 or 3 days and see how that works. Okay. I know it's sore. I know it's going to bleed. And also I want to see if you notice yourself clenching your teeth at all. And my definition of clenching is that your teeth really should only touch if you're chewing food. If your teeth are touching, you're not chewing food, that's a clench. Every time you clench, you're putting stress on certain areas of your mouth, and that's where we're getting breakdown. And so if we can manage that, everything becomes so much more predictable. So let's see if you can catch yourself. So I send them home with some kind of homework, and they can come back and report it back to me. So in a week or so, I'll bring them back for the review of findings. Before I go to there, any questions about how I close that initial consultation and discovery process? All good? Okay.
Yes.
Okay. So I bring them back a week or so later, and we'll start going over the review of findings. So we as dentists, what do we provide for our patients? Some people say, well, I do crowns, or I do fillings, or I do gums or whatever. And, but we really provide peace of mind. And it's based on the patient's goals. Sometimes they have their goals articulated, sometimes they don't. And the Latin definition of doctor is a teacher. Our job as doctors is to bring our patients up to a level so they can be as healthy, make healthy choices and be as healthy as they possibly can.
Dr. Kessler, excuse me 1 second. Hey, Dr. Liz, were you trying to ask a question? We can't hear you,
Liz.
I thought he was trying to ask a question. She was trying to ask a question.
Looks like she's trying to tell us something, but we can't hear her. Your microphone.
Type it in the chat.
Sweetheart, she's on her phone, it looks like. while she's doing that, I'll just say,
Yeah.
no, we get it.
No, I was just saying the mic is on the bottom left.
Looks like her mic is on, but it's not working.
She says, is the training from Pankey Institute? Yeah, in the beginning he said some of the training was like he trained at the Pankey Institute back
Pankey,
in.
Dawson, Spear,
Mhm.
Coyce.
Okay.
Yeah.
Yep.
And the discovery process came from the Pankey Institute directly. Um, so before I start this next appointment, I'll tell my patients, that everyone deserves to hear what ideal dentistry sounds like for you, and this is what it sounds like for you. Okay, feel free to just listen in. Feel free to accept some of it, all of it, or none of it. But basically, what you paid for last week is for me to do a thorough exam of everything in your oral cavity and how it relates to your overall health. And so I just want to give that to you, and you can decide what to do with it. So I try to take a lot of the pressure, the sales pressure off of the patient. So they will listen because they're already going in their head, this is going to cost a lot. And I don't want them to. I go, this is just me just telling you what I saw. And there's some teeth that are high risk, some teeth are low risk. But based on your goals of what you told me last week, I just want to make sure that this is all accounted for. So at least a path to achieve those goals. So it's a continuation of the co-discovery process, usually scheduled about a week later. Again, I sent them home with homework. I want to hear back with their homework. But the key question here is, based on what we discovered at your last visit, how do you feel about the health of your mouth today? Okay, so we've taken them from really just basically, if they had no issues, now they've got a lot of things to think about, and how do they feel about it? And a lot of say, well, I feel fine. Everything's fine. Nothing you said made a difference this week. We're good. I just ready for my cleaning. Okay, great. And then we go there. And that's the end of my discovery. Let me know when you want to hear about some teeth that I'm concerned about. Well, you could tell me. You could tell me. They want to hear that. Okay, but I want them to feel like they're in the driver's seat. And so again, trying to get in the psyche. Remember, sales 101. The best salespeople get into the psyche of their customers, of their clients. We as doctors, in order to do our best work, we need to be in the psyche of who's attached to those teeth. Liz, you looks like you're back. Did you have a question? Still can't hear you. Okay, I'm gonna go forward. So we start reviewing pertinent findings. So I want to know how they feel. Where are they at with their dental IQ, and how much gauging their level of interest, I guess, is what I'm going to say. Okay, so I'll start reviewing pertinent findings so the patient discovers the problem. So this is a case, and this is the best illustration of how powerful this is. So this was Tim. Tim was my patient probably 2 years into my practice, 2005. Tim at the time was 52 years old, healthy male. He was a smoker, smoked about a half pack a day. His chief concern was he wanted to get established with a new dentist closer to home. It had been 8 months since his last visit. His last visit, he had a cleaning and a checkup. His goals for his teeth initially, what he said to me at the discovery interview, was he wanted his teeth healthy and his gums healthy, and he wanted a whiter smile. Everybody says they want a whiter smile. Just be ready for that. Okay, so this is the review of findings. So I'm reflecting back to Tim what he reported to me in the discovery section. I did not do anything clinical yet. So this is review of the findings from the discovery interview, nothing clinical. He reported that he had no pain or sensitivity to hot, cold, sweets, or chewing in any areas of his mouth. He had no pains in his gums. He brushed twice a day. He rarely flossed. He used Listerine occasionally. Doesn't notice himself clenching or grinding. I'm going to go back to his picture. Okay, you can see some wear on his front tooth. I see it. Some problems with his smile there, but I definitely know he is is or was a grinder. Okay. He mentioned in the discovery that he did have headaches a few times a week, temporal headaches, but they were stress related. And he used the quotes on there. He was happy with his smile, but it could be a little whiter. So then I went and did the comprehensive exam, and at the discovery, the next visit, I went through that with him. So in the comprehensive exam, he had pocket depths greater or equal to 5 millimeters with bleeding on probing in all 4 quadrants. Remember, he's a smoker. It's 8 months since his last visit. Rarely flosses, so he's going to be prone. I'm already predicting he's going to have a perio, some kind of perio disease. So he had pockets that were in line with that. He had fractures in back teeth. He had wear on his upper and lower incisal edges and on his anterior teeth. His initial point of contact and centric relation was 2 and 31. So the posterior second molars, upper and lower right second molars. There was a 2 millimeter anterior slide. He had canine guidance in both directions. He had decay or leaking margins around a couple of teeth. He had stained teeth, an uneven smile, and he had lower crowding. And so I took the SLR pictures and I put these up on the screen in front of him. And again, you can see now the close-up of his smile, and you can see where there's wear, especially on 8 and 9. You can see wear on number 10, and there's a little like dip on the incisal edge where that canine would fit right in. And you can see the lower crowding and wear on his lower anterior teeth. Again, I could see wear across the room on my patients, but I'm focusing on that, and it's a big part of my practice. Again, manage the bacteria and the inflammation in the mouth and manage the forces. Your dentistry is going to be able to work for a long, long time. If you manage the bacteria, but you don't manage the forces, something's going to break. If you manage the forces, but don't manage the bacteria, something's going to break down. So you get those 2 things, you can figure it out. That's why occlusion was so important to me. And so, I showed him this and he's like, "Ooh, I don't like the way my teeth look." And I'm like, "It's, you mentioned before that you like them whiter." And he's like, "Yeah, I want them whiter, but I don't like the way they look so close. So let's not look at that too much." I'm like, "Okay." And I showed him a side view and he's like, "What are these? What's that black? Is that a cavity? Is that a cavity? I don't like these stains." And I'm like, "Well, that's probably from smoking." And, someone did fillings there, and the fillings get stained with tobacco and things like that. So, so I just, letting him see things and talk to him about it. I did occlusal shots. Again, not the greatest picture. Nothing I do is ever perfect, but he would breathe. He took a breath right when I was taking this. But he zoomed in right here on 8 and 9 and the edges. He's like, "What are those dark yellow, dark brown, those brown lines on my teeth?" And I went to the facial surface where I see like a craze line. He's like, "No, right on the edge." He went and pointed to it. I was like, "Well, that's where." And he's like, "But I don't grind my teeth." I'm like, "Yeah." And then I brought the mirror back to him. I had a patient mirror in this consultation room, and I had him move his teeth forward so the edges fit together like we did in the exam. I go, "This position is breaking your teeth down. Do you ever notice yourself here?" He's like, "No, I never notice myself there." I'm like, "Well, you're doing it. Maybe you're doing it when you sleep." By the way, you also mentioned you get headaches a couple times a week, and they were right here. And I pointed to the temporal part of his forehead. Okay, these muscles right here, overuse of these muscles are known to trigger headaches in certain people. And, and that's the muscle that's, part of clenching and part of grinding. So I've got some ideas on seeing if we can discover that. He's like, "Okay," because I really don't like those lines. He keeps talking about those lines, and we took a close up of it. And then the lower teeth again. He nothing really to notice, but I focus in on number 2, and I showed him the breaking down fillings and the crack right through the middle of the occlusal surface, a crack down the lingual, a crack on the palatal cusp right here in many different ways. I go, "This tooth you are hammering together. Remember when I guided your teeth closed in that weird position?" And your teeth, your back teeth are taking the brunt of the force right here, and it's starting to break down. And your teeth are the strongest substance in your body. Your bite is breaking this. So we got to find a way to manage this. And so I think this is related to those front teeth wear, and I think it's related to your headaches. And he's like, oh, okay, whatever. And so I wanted to try something. And so, oh, then I put this one on. He's like, I can't stand that. For whatever reason, it triggered him. The wear on 8 and 9, it triggered him to no end. And so, but I already got him interested in occlusal therapy. I showed him the wear on number, I think this is 7, the wear on the canines on 6 and 11. I showed him the x-ray to go, there's some bone loss back here. That's what the gum disease thing that we were talking about, the bones going away. If that goes away, there's not a lot I can do to replace it. I know implants, are the thing, but I can't place implants if there's no bones. We got to stop that bone loss. And you said your goals were to keep your teeth. So, we got to take care of that. Okay. Nothing really happens in the bite wings. But then I'll start to present treatment to him in the order of health, function, and aesthetics. Okay. So I started with initial periotherapy. He didn't want to lose any more bones, so he was okay with that. He recognized that, because he wasn't flossing, because he was smoking, because he hasn't been as diligent in coming to the dentist, he had gum disease. He saw the bone loss and he didn't want to lose any more. I put him in a Lucia jig, anterior deprogrammer, just as a test to see if we can, shut down some of that muscle activity. And we made it for him. I don't think I charged him more than a couple $100 on it, but he was all in on trying it. And 3 days later, he calls me up, not appointed or anything. He calls me up and said, Dr. Kessler, that little puzzle piece that you put on my front teeth that I wear, I haven't had a headache since we put it in. I didn't realize how bad my headaches were. And I'm like, wow, that's amazing. That's so interesting. So apparently we were able to shut off those muscles. And I think that muscle activity was causing your headaches. Well, I don't know what it is, but I feel so much better. What else do we do? How can I make this work? I don't want to wear that little piece. I'm like, okay, next time you come in, we're gonna look at what's next and see what's going on. And so, when I brought him back, his jaw, when I manipulated him into CR now, was totally loose and deprogrammed and ready, and I was like, okay, so we've shut down all that muscle activity. Means we shut down the clenching. Okay. And, when I do a Lucia jig, when I do an anterior deprogrammer, when only the front teeth are touching on that little jig, 75% of the muscle activity shuts off automatically because the brain has a stopper in there that says, hey, do not fully bite because you're going to break your front teeth. And so it automatically shuts itself down. And so, okay, so now we've got your jaw in a happy place. Your muscles are calming down. Remember how I showed you that broken tooth on the top there? Yeah. That's the kind of thing that that extra activity, that extra clenching that you were doing caused that tooth to break. So now we've got you relaxed, but it's only when you wear that little piece. And so we know this is the right position for you. Let's look and see how we can get all of your teeth to touch right with this position where the muscle activity is appropriate and not excessive. And so then I transferred him into a full occlusal guard. And that full occlusal guard now is in the same position. And now I'm working on the bite. And for the next several weeks, maybe even 2 months, about 8 to 10 weeks, I brought him back weekly to adjust that guard until there was no more wear on it. So I knew he dictated that it was stable through the behavior and because if he was still grinding on it, I would see the grind marks on the guard. And until there was none, and he reported back to me that those headaches are still no longer there. And okay, so now we've got your practice bite worked out on the plastic. Let's work it out on your teeth. And we need to design your bite along that way as I rebuild you. So I want to take some new records of you. So we had the models already from his initial exam. But now I wanted to do a face bow, and I wanted to do a centric relation, bite relation. And so I can mount it in CR because that's the position that he's in now, that I positioned him in the bite guard. And then when I mount it, then I look at the initial point of contact, which was 2 and 31. And I look at that initial slide, and what do I have to do to reshape teeth or restore teeth or move teeth to get it in the proper position? He was a simple, equilibration. So the philosophy on occlusion, every teeth touches evenly with the forces directed along the long axis of the teeth. The TMJ is in the most orthopedically correct position. I would say the most comfortable position for you. And we've demonstrated that already with the guard. Your front teeth protect your back teeth. So when you grind, your front teeth guide that guidance and nothing in the back is touching. So it protects it. And so I did an occlusal analysis on the mounted study models that I had. And I waxed up his front teeth because as he ground forward, he was so worn down on 8 and 9 that I couldn't get adequate, release of his back teeth in that movement. So I had to give him a little more length. And so I mounted it and I did a model equilibration and I waxed up 7 through 10. Back then I used green wax. I don't know why I used green wax, probably because I had it left over from dental school. And all of a sudden he focused on 7 through 10, like 7. So now this green wax was a beacon of light for him. And all he wanted to do is, you can make my teeth look like that. And I said, Tim, you want them green like that? And he's like, no. I want veneers. Okay. You want veneers. Okay. Okay. He's asking me for it. That's where it went. Okay. He didn't care about the equilibration, but I said, listen, we have to balance a few things, reshape a few things in back, and we'll do that. And at the same time, we will get you prepped for veneers. So this is my equilibration. I did it on the models. Now I'm doing it in real life. Is it perfect? No, but it was stable. Okay. And here's his lowers. Okay. And then I prepped 7 through 10 for veneers. These are his temps that day. He was so happy. Okay, delivered them a few weeks later, did some modification of the equilibration, some refinement, but look at his smile before and after. And don't look at the teeth, look at his face. Okay, the first appointment when I took that first picture, tentative, yeah, I'm smiling. And over the next several months of seeing him through this treatment, the smile became part of him, and it comes out in his face and the facial muscles. And so close up before and after, it's nothing special. It's not that hard. But again, his initial goals, I'd like to get my teeth clean. I want to get established with a new dentist. I wish my teeth were a little whiter. Okay. So if I were a high-paced practice, that's what I would have done. I would have cleaned his teeth. See you in 6 months. See you later. Here's some whitening. Okay. But he spent about $18,000 with me over the course of, a few months. And he asked me for this treatment. I didn't present it to him. He asked me when I showed him my wax up. Okay. I do my own wax ups, whatever, but I've set time aside to do that. And I had time back then to do it. Okay. But he asked me for that. So it went from a simple cleaning, new patient exam to a couple crowns, couple fillings, teeth whitening, occlusal therapy, equilibration, veneers.
Hello?
Because of the discovery process. Hello.
Hi, went through. Hi, Mr. Fred. So I am Liz, and I was trying to chime in because I started off as a dental assistant, and I don't think I appreciated it at the time, but I worked with the dentist that went to approximately, I don't know, at least nine of the Pankey Institutes, and the trainings and the comprehensive evaluations from the perspective of a dental assistant. I didn't understand. It was a big production.
It's tedious, right?
I had to master my alginates. I had to master pouring up the stone. I was a part of everything. It was a big production. And he was definitely heavy on the jigs. So now I've worked in different aspects of being across the chair as a dental assistant to a community health center to working for corporate, Aspen. And my whole thing is I did well in Aspen because of my approach, very similar to yours. However, in Aspen, the corporate world, everything is kind of sped up, but that same approach. So I was curious if the care it is that you took in the comprehensive evaluation, all of those details, was this here a part of the training for from Pankey? Because everything it is that you stated, like the details specifically with the jigs, I didn't understand it as a dental assistant, but now as a dentist, I was just like, this feels like I'm reliving everything.
Very familiar to you. Yes.
I'm under the lens and the scope of a
Uh-huh.
dentist. And then he did the wax ups too. Uh, and it brought the patient, the lay patient that had no idea what the doctor at the time was trying to get the patient to. He gave them all of those options, and then they was able to see it versus them talking to a car salesman and it coming in one ear and coming out the next. It was like it was able to reel it in, and then he put it in their hands. He said, "I'm gonna give you a good, better, and best plan," and
Uh-huh.
then he showed it to them. And then
Yep.
sometimes he would create a device um, with the wax up where they can put it in their mouth so that they could actually see in real time
Yep.
what their smile would be. So
Yep.
now me coming from corporate, this is not the dentistry it is that is practiced in this is not practiced like this in Aspen. However, when I worked in a private office, everything it is that you said, now I actually see it from the scope of a dentist. I just sat there as an assistant and I did what it is that I was supposed to do. But now I understand the importance of it through the lens, through the scope of a dentist right now. So I didn't know if part of that training, all of those details that you did for your comprehensive evaluation, because this everything right now is deja vu, but through the lens and the scope of a dentist.
It sounds like you worked for someone who very similar philosophy as I have.
Very.
And it's again, it's almost a testimonial to those that hadn't worked with doctors like that. And so I thank you for sharing that. Um, so I the comprehensive exam part is one part of it, but this is more focused on getting the patients engaged in it. And
Mm-hmm.
that's the cool part about this, because this is stuff we learned in dental school. We didn't learn it. I'm not telling you anything you may not have embraced the occlusal parts, that I talk about. But I'll tell you, this was my 6th or 7th or 8th job before I started this practice. But I was already learning this stuff in year 1 and year 2 of my practice journey. Okay. And so I worked in some high volume corporate type practices as well. And I was able to, there was one time where I did it on a high volume practice where I met this patient in the hygiene chair. I sat them up. I asked them what their goals were, and they started going off on things. And I asked them to come back for we can talk about this more in depth, where I have some dedicated time to listen and hear what you want to talk about. And so that turned into a full mouth rehab. Okay, in this high volume practice. The
Mm-hmm.
office manager practically crapped her pants. Okay, because I told her, I want you to clear out this day, all the patients reschedule. We're going to put this one patient in this day. We could never do that. No way. What if she doesn't show? You ruined our day, blah, blah, blah. I'm like, I'm going to have the patient pay in advance so we know they're committed. And we're going to make a lot of money that day, because that's what, I hate to say this, I hate to generalize, but everyone wants to make money, but this isn't part of that. But this is how I sold it to, it wasn't Aspen, but it was a high volume practice. And we did the case that day. And I'll tell you, they were scared. The patient was 10 minutes late and they were ready to fire me. Okay. And it was like, hey, we got the money, whatever. But she showed up and we did the case. And afterwards they apologized to me because I was able to do this. And it was a record production day on one patient, and that's, so you can do it. But you have to do it within the system, and then you got to break the system and explain to them why.
No, I mean,
Okay.
listen.
Yeah.
I think it's very, very cool. I don't want to toot my own horn, but I won the award for being the lead performing dentist for Aspen for the last 2 years, and then the 360 moment was when I went back to the dentist it is that I trained with as a dental assistant, because he trained me on the job. And I let him know it wasn't anything it is that Aspen taught me. Everything it is that I learned, why I was able to do how it is that I did, was because of your training. And it pretty much brought him and his staff to tears, because he does it because he loves it. And, and the patients, it wasn't he was selling dentistry, but he wasn't selling dentistry. The patients wanted it because they saw it. They saw it.
Exactly.
And this was before there
Exactly.
was digital. we were doing the wax ups. He did all of his stuff. So I mean, I don't want to interrupt the rest of your stuff, but I just wanted to chime in, just like, wow, this feels like deja vu. So that's all.
Liz, you can interrupt me anytime. That was beautiful. Thank you for that. And it's true. And I assume everyone in this call, you're all great dentists and you're proud of the work you do. I assume that. So, your margins can only be so good. The aesthetics can only get so great. It's how you connect with the patient. It will determine how successful you are. Okay. And the question that was asked earlier about, I've got all this debt. How do I get, so I was seeing 7 or 8 new patients a month. That's all I wanted. That's all I can handle. The patient, I hear about the practices they're bragging. I've got 50 new patients a month. I'm like, how the heck do you do any dentistry? And so I was, outperforming on my small number of new patients, but I was attracting the right new patients. And so, the systems have to be put together to attract that kind of patient to do this kind of work. And I'm not talking about, did this work on the rich and famous, because many were just plain old people, middle-class people who value their health and were willing to pay for it. And so with that demographic, there's not a lot of caries management. They are healthy people. They are already investing in their health in all aspects of their life. This is just one more box for them to check. And so I had to, again, I really loved occlusal therapy. I really loved aesthetic dentistry, really functional type dentistry. I really loved connecting the mouth, the condition of the oral health to the overall health. And so all those things were valued by the people that I was attracting. And that's why they came to me and we were willing to pay for it. Okay. Any other questions? I love these kind of conversations, Liz. So thank you for bringing that up. Any other thoughts?
This is so good. Just chime in. This is so good.
Awesome. So every time, from the very first call, the patient would ask, I've got this, and this insurance, blah, blah, blah. Every time I present treatment, does my insurance cover this? And we've got ways to talk about it, and the key one is to get them in the door, and say, my receptionist would say, well, I'm not aligned with any insurance companies, but most insurance plans allow you to see doctors out of network. But the reason that he's not on any insurance is because he really wants to get to know you and have a relationship with you and not have the insurance company in between that relationship as a gatekeeper of what you can and cannot do. Everyone deserves to hear what ideal oral health looks like. This is what it will look like for you. And he wants to have that opportunity with you. And I'll say the same thing when I tell the patient, it looks like, by then we would have researched their insurance. Looks like you've got $1,000 max. This is going to cost you, X amount of thousands of dollars. We're going to do everything we can to maximize your insurance. But, their insurance is really good about, cleanings and stuff like that. But if there's anything complicated and there's issues in your mouth that is complicated, they don't cover all that much for it. So it's really, we'll do what we can to maximize it. And then, and that's how we talk about that. Okay. I told you how I came to practice this way. Do I make mistakes? Absolutely. Like I said, I never got burned on the case I didn't do. I've got burned on several cases, misjudging patients. I've had lawsuits and stuff like that of things that didn't go right. But for the most part, my patients, accepted the fact that not everything goes so well. Okay. My realization is I am an imperfect human being working on imperfect human beings in a very unfavorable environment. Okay. Everything I do is in a small area. It's dark. It's wet. It moves. And I'm doing it upside down and backwards. And so it's hard. And sometimes when things don't go the way I thought, I'll stop and sit them right up and look them right in the eye and say, this tooth is beyond what I can do here. I'd like to either send you to a specialist, or I don't think this tooth is going to make it. I don't feel it's worth investing a lot of money into it because it's not going to last. I wish it were different, but this is the reality of the situation. And patients were accepting of that. And so, and that's the conversations that I would have. And, it's always disappointing, but that's why I went into dentistry. The hardest conversation I ever want to have with my patient is, yeah, tooth isn't going to make it, as opposed to being a physician where you're not going to make it. Sometimes I had to have those conversations too, especially with oral cancer. Do I practice this way for everyone? I went through that already. Is my practice philosophy for everyone? Yes and no. It's for those that want it, but not for everyone who needs it. Okay. I had a lot of patients that went through this process that weren't ready to be my patients. They thought it was overkill and they didn't care. And that's okay. Some will, some won't. Some will wait. So what? SW4. Some will, some won't. Some will wait. So what? Move on. And, but I know I did my job and I documented it. And if there's a problem, I'm happy to share that documentation with the patient so their next dentist can see it. I've had plenty of comments from other doctors in the area, especially around patients who had TMJ issues. Sometimes I would charge $3,000 for a splint. Sometimes I would charge $5,000 for a splint, and doctors would call me, "You're ripping the patients off." I'm like, it's not about the cost. Is not about the piece of plastic. The cost involves the time I'm going to be spending with that patient. My time is my value, and they get me. They don't get an assistant. They get me. And so, not everyone understands that, and that's okay. I only need about 750 of them. How do I incorporate this into my practice? It was a higher volume practice. I think I went over that already, but do it in the hygiene, slow things down for a little while and get them reappointed on the ones that are, interested in those kind of conversations. And you will slowly morph your practice into something like this if it's something that you want to do, or on a case-by-case basis. These are some resources that were real helpful to me. A couple of books there. Philosophy of the Practice of Dentistry. That's Pankey's book. The Art of the Exam by Dr. Barry Polanski. Another Pankey guy. Great book. Peter Dawson's book on treatment of occlusal disorders. Awesome stuff. And these other ones are some videotapes and articles that were written that describe this philosophy and were mentors of mine. Dr. Robert Frazier is one of my coaches who's been my coach for 20 years. And I've my entire career, I've had coaches. Even as president of the ADA, I still had a coach and mentors. And people who do practice this way are always ready to share what they do, like I'm doing. And Liz, like your doctor did for you, and what a gift it was for him to hear back from you. I get that too. And thank you for doing that. Some other books, Emotional Intelligent Primal Leadership by Goleman. Again, getting into the psyche of the emotions that we face as dentists or that our patients are in. Sales books, Selling the Invisible Touch, again, trying to provide value. So patients will value your services and be willing to pay for it. 7 Habits of Highly Effective People is one of the most impactful books I've ever read. And the people that I mentor, that's one of the first books I have them read.
One of my favorites. I have to chime in. That's like on my list of like top 5 faves. 7 Habits.
So in that book, it talks about, learning your core values and articulating them, and then, developing a mission statement, developing a vision for your life. Okay. Those are the first 3 habits. And I was able to do that with my life. And I was able to do that with my practice to support my goals in life. Really important. It's all comes back to that, really learning about myself and what I felt would be my best options in life. Okay. That's it. There's my contact information. Love to, hear how you all incorporate this in your practices. I am going to just do a little sales pitch. I am starting a leadership development and coaching business. This kind of thing is the kind of thing that I'll be teaching about, helping people find their way. And I'm starting some mastermind type of groups. So you guys would be considered a mastermind group if something that you're interested in. Probably in the next 6 to 8 weeks, that's going to start. so we can have deeper discussions on some of these issues, or maybe issues that you may be facing, and hopefully help you, live the life you want to live and have that practice of your dreams that'll help support your life. So there's my commercial. Thank you.
Thank you. Before you guys hop off, can we take a little screenshot picture? Dr. Kessler, if you stop sharing your screen, then it'll be full gallery. Let me see if I can get gallery. Are you able to do it on yours? Or anybody can do it, actually.
I put on speaker.
Let me see, screenshot.
Gallery.
Yeah. Okay, I'm gonna take it. I'm gonna go ahead and take it. Y'all smile at your camera. 1, 2, 3. That's awesome. Oh my gosh. So this was really good, Dr. K. Thank you so much. Does anybody have any questions for Dr. Kessler before he signs off?
No.
No, I
Questions,
think
comments, concerns? Yeah, this
I
was
want to say thank
good.
you for sharing this information. Yeah, it was real good.
Yeah, and these are people that Dr. K that I'm always in community with. I'm always like reaching out. Liz and I, we do dinners, brunches. We're very close. Tony, Jimmy, and I, we went to school together. So yeah,
Sorry,
maybe
it was
y'all, we might have to
bedtime.
start. Same for me. We might have to start supper club. But you
There
want
you
to take a
go.
picture real quick?
I did not. With the teddy bears I was given, yes.
You can.
No.
Okay, that's okay. Dr. Kessler, I'll send these to you.
Okay.
Yeah.
Yeah. So hey there, big guy. It's probably dinner time for you all. It's dinner time for me. I'm going to the Nuggets game tonight. So yeah, we
Okay,
last
nice.
game before the All-Star game.
Yeah.
So it's awesome. So I hope some of this stuff resonated, and slow things down to be more productive, work smarter, not harder. And especially in all of your levels and where you're at in your career. I was about 8 years into my practice career when I started my practice. And so, you are your most valuable asset. Take care of yourself as such. And, and don't, burnout is prevalent in our profession. And this is a way that I was able to stay out of it.
Burnout is very real. I've quit my job twice. I've quit it twice. They were just like, "But you're so good," and I was like, "This is abuse. This is abuse."
It's hard. It's hard, and but I found a way to make it not so hard and fulfilling. And I don't know if you're on, but I, like, right before this presentation started, I had a patient text me. I've got a relationship-based patient. They all had my cell phone number. When I haven't practiced, I sold my practice in 2018. They're still calling me, asking me where they should go to get their teeth fixed. That's the impact that I had. It wasn't treating teeth. It was treating people who had or didn't have teeth, that wanted teeth. And yeah, so take the time and figure it out how you can maximize your impact in the skills and the gifts that you have to offer your community. That's only you can give. That's what's you're special. And if you're living in your special talents, you will have a fulfilling practice life and a fulfilling life too. Okay.
So good.
So
thank you, Dr. K.
Thank you so much for your time. This was really cool. I got excited when I was just like, God, Lee, this felt like I was a dental assistant. Oh man, it was 2007. 2007 and 2008, and the way he did practice, and I loved it. I felt like the patients felt like they were going to see the homie who cared about them, and then gave them all of the options. It didn't make him feel like, well, do this or die. It was just, he put it in their hands and he showed them. And this is before digital dentistry. So we were taking the pictures with them heavy cameras. I hated it. As an assistant, I hated it. But I can make the best pour ups. I learned how to mount. I learned how to do all of that stuff before I went to dental school. It handicapped me when I went to dental school because I had already knew it. I just didn't know the science behind it. But I knew from the aspect of a dentist that trained me on a job for everything. But I didn't understand the science behind it. I just he made all of these weird jigs. He did it. he made everything. He had Invisalign before there was Invisalign. He was just we'll make your own trays. We're going to do this. He was the bomb. He's still doing it.
That's awesome. And the difference I had with my practice is I started from scratch is I had a lot of time early on with my staff, with my team. And so they understood everything. And so they were able to reinforce it after I walked out of the room. And because they understood it.
And I train dental assistants now where they understood it. But as a dentalist, when I was a dental assistant, I did it without the understanding. And he made us a perfectionist, but I didn't understand why it had to be perfect. I could have cried doing a pour up. I could have cried doing all of that stuff. I was dipping x-rays. I was dipping it. I go bad, girl. This is
that's the day.
And so I from the lens of a dentist, it was just like it felt full circle.
Yeah, that's awesome. I'm so happy. Thank you for sharing that. And Arnell knows me in a whole different world. This was a different Brett that that you know, and so you get to look under the hood a little more.
Yes, I love that.
And because I was able to practice this way, it gave me the ability to lead in different ways. And I was productive enough where I could dedicate my time to the leadership aspect of dentistry and not be so high volume where I had to be there all the time to do this. And, so I was working about 3.5 days a week. And my wife is an orthodontist. She had a full-time practice. We worked together. She's still practicing. I'm not practicing right now because of my previous job, and I'm looking to make impact that way through extending my leadership. So, yeah.
All right. So, well, this was wonderful. I texted you already, Dr. Kessler. We got to do this again. We'll figure out some dates.
Okay, we'll be in touch and figure that out. But I hope I hope you have a great night. Enjoy your family and get some dinner, and have a good rest of your week.
Thanks so much.
Thank
you. Enjoy your game.
Yes, enjoy the game. Bye.
All right. Bye-bye.
Thanks for adding me, Arnell.
You're welcome.